How far do you travel to get fresh fruits and vegetables? How long is your commute to work? Are there nearby parks where your family can exercise? These are some of the issues being considered as Clark County updates its 20-year comprehensive growth management plan with strategies that promote and protect health. State law requires this plan to ensure that as the population grows, there are services to meet the demand. The next plan update is scheduled for 2014 and for the first time will include a health element.
The vision for Clark County is a healthy community for all ages. And by crafting a health element, what we are really drawing attention as a community that this is important. We have other elements not required under the Growth Management Act. As an example, we have a school element is not required. So I think we are beginning to look at the built environment. It's not new. So this is something that the community is coming together to say that it is important and we have to include it in our land use planning effort.
Well, I think all of us want a healthy community. Businesses want healthy workers, schools want children who are healthy when they come to school, and we want retired people who are healthy and can be active in their community.
The health element looks at how land use and the built environment can be modified to promote healthy behavior and prevent chronic disease.
About 7 out of 10 people today die of chronic diseases like heart disease, diabetes, cancer. And what we know is that how you build communities can actually affect people's physical activity and their access to good nutrition.
Work on the health element is expected to last through 2011. Ongoing research and analysis conducted by public health and planning staff will help integrate the findings into the growth management plan. The health element will examine current conditions in Clark County that facilitate physical activity, healthy nutrition, and other opportunities for healthy choices.
Some of the kinds of things we're looking at is what percentage of people live near a trail or parks. If we want people to be active and healthy and make it convenient, we want to know just how convenient is it for people to get there. As we look at development and looking at, for example, C-Tran and where the bus lines are, let's put some higher density housing perhaps next to the bus stop areas so that people can use public transportation and have a reasonable walk to the bus stop. So there are things like that we're looking at. How do we support locally grown agriculture and support community-supported agriculture programs, community gardens.
Public health staff have hosted a workshop for policymakers with experts on active, livable communities. They have also hosted 2 community forums and given presentations to county and city neighborhood associations. Public outreach will continue throughout the year.
We have an extended process here. We had a community forum with some planners who plan across the country, giving our policymakers and other neighborhood leaders information on planning. We've held a couple of community forums in Battleground and in Vancouver, getting input from the public. And our Public Health Advisory Council, a 20-member council that advises the Board of Health, the county commissioners, is involved in looking at the drafts of our plan and giving us input into that.
The health element that will be presented to the Board of County Commissioners for adoption will include recommended policies and strategies specifically designed to improve the long-term health of county residents.
If we are very, which I'm sure we will be, successful in developing a health element, we will be one of the first counties in the state to have one. Like I said earlier, it's not required. So, but we are moving and seeing the relationship between built environment and land use, that we would like to have this element be included in our plan. And if we can amend some of our development standard, whether it's an encourage, whether it's mixed use, a different way of building, different way of designing, a different way of implementing our goals and policies, I think it will be a benefit to all ages.
For more information about the Growth Management Plan, contact Clark County Community Planning at 360-397-2280 or visit clark.wa.gov. For more information about the health element, call Public Health at 360-397-8122 to speak to the Community Health Manager or visit their website. Please complete the Healthy Community Survey at the following website: